Right, we'll get going, and then if more people join, they can drop in. So, good morning, everyone. Thank you very much for joining us. My name is Rusty, and I'll be sort of running the session today. And this is the second part in our Tees Valley Innovation Challenge healthcare webinars that we're putting on. So we're going to talk today about the innovation pathway that we have at Health Innovation North East North Cumbria. And then there's a little overview on your screens of what we'll be covering today. So I'll just give a bit of an introduction. Chloe will go into idea assessment, followed by Eleanor, who will talk about how to create a good value proposition for your innovation for the NHS. We'll look into innovation and net zero by Hannah, our sustainability lead, and then PPIE by Ben Porter. Ellie will go over evaluations, so things like clinical trials and real world evaluations. And then finally, Anna will sort of talk about the process of innovator engagement and sort of how we do things at Health Innovation. So the next slide, please, Hannah. So hello, this is me. I'm a program manager at Health Innovation North East North Cumbria. I'm in the economic growth team, as are most of the presenters who are speaking today. And we work closely with innovators throughout our innovation pathway. So I'll talk on the next slide a bit about the HINs and what we do. Next slide, please. So we are one of 15 across England. We were established in 2013. So the aim was to improve health and generate economic growth. And we're seen as the innovation arm of the NHS. We're commissioned by NHS England and the Office for Life Sciences. And we essentially work with healthcare organisations and businesses to support all types of innovation in the NHS, from new technologies to ways of working and then service improvements, for example. And we do this to improve services for patients, to enable NHS efficiencies and fundamentally to support economic growth. So next slide, please. So this is the reason that we're all here today, to learn a little bit more about our innovation pathway. So this innovation pathway is bespoke and was created by Health Innovation North East North Cumbria, and it enables innovators from the NHS industry to access bespoke services across the entire life cycle. So it aligns very closely with the discover, develop, deploy ethos that underpins what all of the innovation networks do. And then we've sort of broken that down into this kind of more digestible pathway. So as you can see, there's 5 gateways. So we support innovators all the way from, from the very basics of initial idea, so idea assessment, or through to idea development, evaluation, commercialization, and then spread and adoption. So this innovation pathway is central to the North East North Cumbria region, and it provides sort of a robust structure and process to best support innovators in health and social care. So from this idea, initial idea conception, we would then support innovators all the way through to adoption by the health and care sectors. We support innovators to develop innovation that improve population health and support the regional economy. We provide sort of this robust service framework to guide innovators through. So we break down the journey of an innovation into the key stages of assessment. So within each of these gateways, there's sort of more digestible chunks to understand and to acknowledge and get to grips with, what kind of information are you needing. So the range of services that are delivered by us and the wider ecosystem can lead you through each of these stages. And what we do is we work closely with partners, stakeholders, regional and national networks to ensure that you receive sort of bespoke services to what you and your innovation requires. So we work closely with individuals who are on our system to be able to deliver some of these services. So for instance, there are a range of companies who'll be able to facilitate PPIE, clinical trials and evidence generation, business case, etc. So that in a nutshell is a very high level overview of our innovation pathway. Next slide, please, Hannah. So what we do is we have an ecosystem which is full of suppliers, and we work with partners to deliver bespoke services to innovators across the pathway. So here's just a handful of examples of the companies that are on in our ecosystem and have come into our ecosystem on this on our DPS system. from our database. So we will outsource some particular pieces of work that innovators are requiring to particular individuals, and we work sort of, as I said before, regionally and nationally with partners. So that's a very high level overview, whistle stop tour of the innovation pathway. So I'll pass over to Chloe, who will go over Gateway 1 in a bit more detail. So over to you, Chloe.
Thanks, Rusty. So hi everyone, my name's Chloe Blewett and I'm a project manager at Health Innovation North East North Cumbria. So today I'll be talking about idea assessment, which, as Rusty mentions, is the first gateway of the innovation pathway. So next slide, please, Hannah. So yeah, as mentioned, idea assessment is the very first stage of the pathway. And generally what you'll be looking at is you will have formed an idea for a product, a test, a treatment, etc., some form of innovation, and you'll be looking at furthering this idea by looking at things such as whether your idea is innovative. So is your idea something new? Are there options currently available that are being used? And if so, how well do they work? You'll also want to be checking whether there's an unmet need for this. So it can be difficult to have an innovation adopted by the NHS if there isn't necessarily a need for your innovation. If things are working well, then generally consultants and whatnot won't really see a need to take on something new. You'll also want to look at gathering feedback from experts and protecting your idea through things such as patents and copyright, etc. So as you can see here, these are the hexagons that make up the idea assessment phase, and we'll be running through each of these hexagons to give a greater understanding of what each one entails. Next slide, please. So starting with basic research. So the two little images that I've kind of popped on here, the little cartoons, are what I kind of think of when I think of basic research. So very much kind of white lab coats, microscopes, cells, that lab type of setting. But basic research is also known as fundamental research or basic science. And it's a type of scientific research which focuses on advancing knowledge instead of looking to solve a specific problem. So an example of this could be that when we learn about how cells talk to each other, or the discovery of DNA and neurotransmitters. And this knowledge can then lead to unexpected breakthroughs in preventing, predicting, diagnosing, and treating disease. And it's fundamental to discovering new innovations since it forms our basic understanding of how the body and the world work. So just going back on those examples that I gave, the discovery of DNA meant that cancer treatments could then be created, and the discovery of neurotransmitters means that antidepressants could be created. Since we had that understanding of how those things worked, we can then create interventions to help treat diseases. So then how can HINENC support you with basic research? So HINENC has a wide range of contacts in industry, academia, and in the NHS. So we can broker conversations with the relevant people, so you can understand what research is being conducted, and we can also facilitate the identification of innovative concepts as well. And next slide, please. So moving on to expert feedback. So I didn't really feel like we need to have a formal definition of what expert feedback is. I feel like it's sort of just what it says on the tin. But feedback from clinical teams is important as it'll help you to understand if your innovation will add value to the service, if it can be used as you intend for it to be used, and to understand the potential impact that it can have. And a broad range of clinical input is useful to understand whether your innovation would work in different settings, different sizes of organizations, or whether it's linked to a key focus. So it's good to get feedback from different trusts, for example, different regions, and different services as well. And in turn, this will then help you to understand your target market And you can also receive feedback on whether your innovation would be likely adopted into the NHS. So the way that we can support with expert feedback is, again, we have a wide range of contacts, and we can identify clinical teams at different trusts and then broker those conversations, so you can receive the feedback that you need. And then moving on to culture. So we want to change the way that innovation is understood and embedded into the NHS. So we want people to realise that research and innovation are things that we can all be involved in. So it's not restricted to sort of people that work in labs, people that work in hospitals, people with a certain qualification or whatnot. It's for everybody. And the way that we're emphasising this and sharing this is through providing regular networking events, learning sessions, forums, blogs and podcasts to facilitate this discussion and bring innovation to the forefront. And we also ensure that we have, again, those key contacts within academia, industry, and the public, so the correct stakeholders can be engaged and informed throughout innovation. And we want to ensure that you have the correct involvement in your innovation as well. So there is some slides later by Ben Porter around patient and public involvement and engagement. And it's just emphasising as well that it is really important to have public and patient voice heard throughout your innovation as well, as at the end of the day, they are part of the key customers. So that is incredibly important to consider. And next slide, please. So moving on to ideas and intellectual property. So a very exciting subject. IP is a legal framework and it protects ideas, concepts, innovations, and any results of mental effort. So IP stops others from using your idea without your permission, and it can protect things such as the name of your product or the brand, your inventions, the design or the look of the product, or the things that you write, make, or produce. And there are some different categories of IP. So I've included some of the basic ones within this table here. So you have patents, which protect how something works, trademarks, which protect branding, design, which protects how something looks, copyright, which will protect the expression of an idea, and know-how, which protects occupational knowledge. And it's important to hold the correct IP rights, especially when you're looking to build your innovation and begin to look at investment opportunities and to have different people involved, specifically because stakeholders will want to know that you have the correct protection of your idea. And also because as you're beginning to develop your innovation, you're going to start speaking to different people and sharing more of your idea. So you need to make sure that it's adequately protected. So at HINENC, we can provide guidance around what IP you may require, and we can sort of walk you through the process. Or if necessary, we can also put you in the right direction of people who can provide more specific knowledge potentially as well. So that's a support that we can provide around that. And then next slide, please. So unmet needs. So we work with our regional health and care system, such as our NHS trusts, and they will tell us if they have any challenges or clinical needs that they're facing. And we can then get in touch with our industry partners who might have a solution of some sort, or we can get in touch with our contacts that we hold on the system to see if they are developing anything specific, or we may also share this information through an unmet need call. And all of this lets innovators know that there is an opportunity in this area. And it's important for you to consider that your innovation is needed in the NHS. Things, as I've mentioned, don't generally get adopted if they aren't needed. It's difficult enough, like it's a difficult process for services and trusts to have new things adopted, since they need a lot of departments and people to be on board with this. So for example, you need approval from finance teams, from head of services, and generally there needs to be a need for change constructed. So if what is available is working fine, then it's really difficult to be able to get something approved and to emphasize that this new thing should be brought in. So it's really important for you as an innovator to understand what challenges are currently within the service that you're looking at, or in the trust or the NHS in general, for you before you begin to develop your innovation further and put further time and money into it. And then market analysis, or market research, as it's also commonly known, I guess. So this determines the demand and the need for your innovation. So market research will check whether there are existing products on the market, or whether other things are currently being used that are fine. And things such as patent searches can be conducted, where research is done to identify any existing patents related to an innovation or an idea, and literature searches can also be conducted to look at published data to gain knowledge, recommendations and comparisons between products. So this then allows you to see any opportunities or constraints in the market. So you don't want to be necessarily creating an innovation in an area which is already potentially heavily saturated with ideas. You maybe want to sort of look at areas where less ideas are being created, or you want to look at maybe what is unique about your innovation if the market is heavily saturated. And part of market research, I think, that I wanted to emphasize is it can be easy to think that your idea is the only idea out there, or it's the best and has the most unique selling points. But it's incredibly important to conduct formal market analysis or market research to understand what is currently available and what's currently being used, and what really does set your innovation apart from the others that are available. And again, I think sometimes you can build an idea from an experience that you've maybe had, and think that because that experience maybe happened to you, that this happens to everybody. But again, that's not always the case. So for example, you might have had a really long wait time for an appointment. And so you maybe go away and think, I'm going to create something to address this problem. But that might not always be the case all of the time. It might be that that specific service was having a tough day. It might be that that only occurs in that specific service or in that specific trust. So it's important to look at what is currently being done and check if this is actually a problem. So in terms of how we can help with market research, we have Nick Harrison, who is a market researcher and can provide formal market research and market reports, or provide support and advice. And we can also point you in the correct directions as well, in terms of looking at literature, and looking at what's already available as well. So we are more than happy to support with that side of things too. And I think that's everything. If we pop to the next slide, I think it's just if you have any questions. That was quite a whistle-stop tour, I guess. But yeah, if you have any questions, please do let us know.
Thank you, Chloe. That was really, really good. It was a really good overview of Gateway 1. I think if there's no questions, if anyone thinks of any questions, feel free to pop them in the chat and we can try and answer them as we go along. But thank you very much, Chloe. That was really informative. So now we'll move on to the next session. So this is Eleanor, and she'll go over how to create a value proposition. So over to you, Eleanor.
Thank you. Hi, everyone. So yeah, I'm Eleanor. I'm one of the program managers here at Health Innovation Northeast North Cumbria. And next slide, please, Hannah. So you've seen this a couple of times by now, and this is just to show you where the value proposition sits on our innovation pathway in terms of one of the hexagons. However, I wanted to also point out that it's not just there, because the value proposition is an ever-evolving document, really. So we also look at it later on in the pathway, and I'll expand on it towards the end of my presentation. So next slide. So what is a value proposition? So in a nutshell, a value proposition is a clear and compelling document that explains how your innovation solves a specific problem or fulfills a need. So basically what we've seen so far from Chloe is like, how do we put it all together in one document that highlights the benefits of your solution and why it's better than the alternatives, and focuses on delivering measurable value to stakeholders like patients, providers, and whoever pays for the innovation as well. So next slide, please, Hannah. So what makes a good value proposition? So first of all, a bit like we've touched on before, it needs to be solution focused. So you need to make it clear that you're addressing a key problem in the healthcare space, and what this problem is and how you are tackling it. So a good value prop provides benefits that other solutions out there do not, obviously, which is why you're intervening. So you need to demonstrate how this would improve either the patient outcomes or any operational efficiencies, depending on what your innovation is. It needs to have evidence-based impact. So don't just tell us how your innovation will solve an issue, but actually show us through the data and the evidence that you've collected. So this should also include some estimates of cost savings for the health system, for instance, or improve outcomes for patients, etc., etc. The goal ultimately is to get your innovation adopted by the system, of course. So to do so, you need to craft a message that resonates with your audience, whoever the audience may be. Next slide, please. So what a value prop is not. So it's not just a list of features. So we do ask that details should be kept concise. At the same time, features are also important when they tell us how you're meeting the need or the challenge. So I could be saying that I've got an innovation, which is a magic wand that instantly will cure any patient from a cold. But I need to explain how this wand will work. Otherwise, it's not really an innovation. It's just a bright idea. Value prop is also not just a marketing statement. So Nike, just do it, or L'Oreal, because we're worth it. It's all very nice, but that's not what a value prop is. It should be obviously a bigger document than that. To be clear, it is also an essential tool in marketing. Like marketing is based on value propositions, really. So it's just it's not even an elevator pitch. It's the summary, basically, of all the reasons why your customer, your audience should consider your product and your innovation. The value proposition is also not your proof of value or your evidence base, which brings me to the next slide, please. So the difference between value proposition and proof of value, because the two are often conflated. The value proposition is the promise of the benefits that your innovation will deliver. So it's more about, this is your idea and this is why you think your idea will work. So this should be based on facts, obviously, and not just imagination. But if I go back to the magic wand that cures all colds, just because, because this thing doesn't exist, it cannot have a strong value proposition regardless of the benefits it might have. But when you're drafting your value prop, it's quite normal that you will not have a lot of physical proof and evidence of your, the benefits of your innovation. You will just have an estimate of what this will be based on research, based on the whole research that you did in the first gateway. The goal is to obtain the data through real-world evaluation and economic analysis, which you'll see a bit later on in this presentation. These exercises will provide evidence that the innovation delivers on what has been promised. So this is what we call a proof of value. So it only comes along later, really, in the innovation pathway. And that's also why I said the value proposition is an ever-evolving document. So you'll go back to it time and time again. So next slide, please. So how to build a good value proposition. So there's the building blocks. The first thing to do is define who your audience is. So this is almost never the NHS, but it could be patients, it could be clinicians, it could be the admin staff, the commissioners, etc. So it will depend on what your innovation is, but think about who will be using it as well as who the innovation benefits. So the magic wand that cures all colds is aimed at the patients, but it would be used by a doctor, for instance. So you'll be crafting the value proposition with this well in mind. You also want to be specific. So you need to explain exactly what the problem is and how you will solve it. So it's not an overly academic exercise. So it's not about, writing the entire research paper. Just explaining in simple but specific terms. So instead of, say, patients are presenting with ailments, you'll want to say patients are presenting with cold symptoms, and the solution isn't just a magic wand, it's a wand with a powerful medicine developed by qualified laboratories, which prove to cure people of their colds. So you also want to quantify the benefits. So you need to do a bit of research there to use data to define what your innovation means potentially for the health and care system. So think about the wider system as well. So again, the magic wand that cures all cold is going to be good for patients. It will save the NHS money by saving the need for prescriptions and further GP visits, for instance, but it will also be good for the wider economy, because it will allow people to miss less working days, for instance. And you can and should at this point do an initial draft cost-benefit analysis. So this will take into account the cost of your innovation, how much did it cost to put it together, how much will it cost for someone to purchase, versus the amount of money that it could potentially save the system. So these numbers are not going to be 100% accurate at this stage because it's very early on. However, it's good to have an idea of what these will be, because this will be the building blocks of your business case ultimately, and what you will need for the spreader adoption side of things. Then you will want to highlight the differentiation. Again, going back to the market research, just make sure that you know exactly what sets it apart from other solutions. Something to remember here is remembering that the status quo, so what is currently being done, is another solution. So when you say, my solution is the only thing on the market that does it, remember that something has been done so far anyway. It might be less cost effective and it might take more time, but it does exist. So just always keep in mind the status quo is also a solution. And finally, you need to tell a good story. So don't shy away from, trying to tug at the heartstrings a bit with why your innovation is needed and why is it important and why is it groundbreaking. So in the case of the magic wand, I could mention how great it is when you have small children coming back from daycare full of bugs, and you can just instantly cure everyone of all ailments in that way. So, just think about what will resonate with your audience when you craft your value proposition. Next slide, please. So as always, don't worry too much about how does a value proposition look. We do have a template and we can help with that. So our template mostly focuses on crafting something with these 4 slots in mind. So knowing the problems that we're trying to solve, the consequence of these issues, the intervention that we're having, and the impact that this will have on the health system, as mentioned. Next slide, please. So as we talked about before, this should be catered really to the different audiences that we've got. So our patients, for instance, affected by colds and the magic wand, and how is the service, so clinicians and GP practices, etc., affected by these things. And finally, what is the national issue and impact on your innovation? So for instance, the economic impact of something that just solves colds would be no missed working days. So productivity goes up, economic growth. But it doesn't have to be about the economy. It could be about sustainability. It could be about tackling health inequalities. It could have several types of impact along the pathway. And this will always impact patient services and the national outlook in different ways. Next slide, please. So this also, again, very much was a whistle-stop tour of the important building blocks of a value proposition. However, there are a lot of other important things to consider, and luckily you'll hear about a few of them later on, such as sustainability and patient and public involvement. These are all very important things that will come into your value proposition. So for instance, sustainability in the NHS, environmental sustainability is all about the fact that the NHS has pledged to become the world's first net zero health service by 2045, meaning that any innovations that contribute to energy efficiency, waste reduction, or lower carbon emissions really strengthen your value proposition. So use that to really make a strong value proposition. And think about how your innovation will impact this, because you'll be asked at some point in your business case, and you will be asked in your spreader adoption work, how does your innovation impact sustainability? Is it sustainable? And also, does it help? Does it make it worse? Same thing with health inequalities. So in the NHS, it's very important to the tackling of health inequalities. And this means basically reducing the disparities in healthcare access, as well as the outcomes and the quality across different population groups. So a strong value proposition should always demonstrate how your innovation improves access to care for underserved communities, for instance, and supports equitable outcomes, which aligns obviously with the NHS goal. But what it means in practice is think about how your innovation might help health inequalities, but also how potentially might exacerbate them in ways that you might not have thought about initially. For instance, some digital innovations could potentially exacerbate health inequalities by creating digital disparity, because not everyone has access to the same level of digital products. You know, they're the same smartphones and very high-speed internet, etc., etc. So always think about these aspects when you're drafting your value proposition. And finally, clinical feedback and patient and public involvement. Whatever your innovation is, it will always need to have an approval stamp from both a group of clinicians and, or depending on what your innovation is, a group of patients to really, tell you what they think about what you've created. There's also something else that is not on this slide, but it's just as important, is the effect that your innovation will have on the current pathway. So always think not just of the specific medicine or scan or process that your innovation goes to replace potentially, but of how this will affect the entire stream of actions that normally need to happen. So will it reduce the workload for people and services that are upwards and upstream and downstream basically in the pathway, or would it increase it? Are you making one bit of the pathway easier for a specific condition, or are you, but also is that making it easier, making it more difficult later on, basically? So just always think about the bigger picture in your value proposition, not just about your innovation, but how your innovation will affect everything else. So next slide. So this is just a table that I'm not expecting you guys to read on this presentation, but it's an idea of what we would use as a scoring system, let's say, to consider a value proposition. When you first draft your value proposition at what we call Gateway 2, so at the beginning, you will never have a 5 out of 5 on this scale. You will need your real world evidence. You will need to have very strong data in order to get to the end. But you can try at the beginning to make it as accurate as possible with the data that you do have while you collect your real world evaluation data, your clinical trials, etc., etc. And finally, next slide. So going back to the innovation pathway, just to understand a bit more how we work with you throughout the pathway. So first you will have developed your draft value proposition quite early on. After you come up with your idea and you got your expert feedback and your market research, etc. done, you will want to draft that. Then you will want to try and gather and collate your real world data for proof of value. So that's when you transition from the value proposition to the proof of value. You will refine your cost and benefit analysis for the business case. So that will be done with health economics data and with the data that you've collected so far. And then finally, you will revisit your value proposition as you develop your innovation further. So this could be for different markets as well. And remember, because you're drafting a value proposition for a specific audience, if your audience changes, then your value proposition will need to change a bit. So it will need to be catered to whoever you're drafting that for. And yeah, I think that brings me to questions. And last slide if you want.
Excellent. Thank you very much, Eleanor. That was a really, really good overview and presentation. I'm just going to have a quick check of questions. So nothing specifically for value proposition, but if anyone has any value proposition questions, please pop them in the chat and then we can answer them as we go along. So thank you very much, Anna, for your time. And then we'll move on to the next presentation, which is Innovation in Net Zero, and that will be led by Hannah.
Hi, sorry, I don't know how to use Zoom. And I'm really not well today, so I'm like trying to just get through the day. But yeah, so I've got on now, so hopefully everybody can see and hear me. So yeah, so obviously Eleanor has sort of done a bit of a touch on sustainability in her slides, so thank you. But yeah, I'm going to go through innovation, net zero, and sort of how it links together. I'm Sustainability Project Manager for Health Innovation North East and North Cumbria. So I sit within the sustainability team, and I have 2 colleagues who also support me on that and supporting innovators through the innovation pathway. Next slide, please. So just an introduction of things that I'm going to try and cover in this presentation. So the climate crisis, just a bit of background of what that actually is, why it's happening, what is net zero. It's a really big buzzword at the moment, but it's probably unclear to people who don't have experience in this area. How does innovation support the agenda? What can you do as an innovator or an SME, and how HINENC can support you in those roles? to getting on your own net zero journey, but also to becoming compliant with the ask of the NHS regarding net zero. Next slide. So first of all, just debunking the terminology, and I said that right because normally I say defunking. So what do these terms mean? You'll hear about them a lot in lots of different ways, on the news, from the government, things like that. So global warming, we've been hearing about that for a while, and that is basically a rise in the Earth's temperature. So a bit of the climate science behind that is everybody will be aware of the ozone layer. Activity on Earth is depleting the ozone layer. So it is breaking holes into it, and then greenhouse gases are filling those holes and making a blanket, which is warming the Earth's surface up. Climate change is a result of global warming, and it's a long-term shift in weather patterns. So basically, heating of the Earth's surface is causing adverse weather and a change in those historic weather patterns. And then all of that is umbrellaed by the climate crisis as a term. So you probably hear about global warming, climate change as sort of similar entities, but actually one leads into the other. So global warming is a component of climate change, and global warming and climate change are both components of the climate crisis. So next slide. So what exactly is the climate crisis? So as I did mention, that everything we do down here is directly damaging the planet. So lots of activities. The most common one you'll probably come into contact with is the burning of fossil fuels, so creating greenhouse gas emissions. This is by doing things like driving your car to the shop. That creates greenhouse gas emissions, and that is what's creating that blanket in the ozone layer and trapping in all the heat, which is warming the Earth's temperature. Global warming, as mentioned, is a contributing factor of climate change and adverse weather events. So we've seen a lot of those in the UK in the past couple of years. So we've had extreme flooding in Newcastle, where the river burst its banks. We've had excessive heat, so 40.3 degrees is the highest recorded temperature in summer last year. That's a temperature we've not seen in this country. And obviously extreme winters. We just feel the cold anyways because it's always cold here, but they are getting excessively worse, and we're getting freak weather in months we probably wouldn't expect it. So I think we've had snow in April not too long ago, which really by April we're expecting it to get a bit warm. And something that we've got to be aware of is adverse weather events isn't just a bit of a warm day or where it feels like it's rained for like 2 days in a row and you're like, oh my goodness, when is this going to stop? This is extreme rainfall, so where you would sort of see a month's worth of rain in like a day or in a couple of hours. And that does happen, and that's what happened, which caused the flooding in Newcastle about 2 years ago. So it's currently recognised by scientists that we have a climate tipping point on Earth. So over the past, I'd probably say about 70 years, the Earth's surface temperature has fluctuated. Since the Industrial Revolution, it's got a lot worse because of all the emissions that occurred from industry. But scientists have sort of recognised that the Earth can tolerate a 1.5 degree increase to what it has been in prehistoric times. However, we are already on the verge of exceeding that, and there's no looking like it will slow down. There has been a treaty that has came out of France, so the Paris Treaty, and that is basically saying 2 degrees is the absolute, but what we need to be doing is trying to keep it within that 1.5 degree threshold. And just why does this even occur to the NHS to address something like this? The climate crisis is currently the greatest threat to human health, and that's in many ways. So that can be through injury and fatality of these adverse weather events. You've seen like the hurricane, that's an adverse weather event, causes multiple deaths, damage to communities, people have to evacuate, thousands and thousands injured, and immense pressure on healthcare. And And then also just other things that you probably don't see or think of. So the air pollution that's generated and how that can impact people with existing conditions such as respiratory conditions, COPD, asthma. I haven't included it in these slides, but actually the first recorded death where air pollution was a contributing factor was an 8-year-old girl in the last 10 years. And she lived in London where air pollution was nearing legal limits. And it has been put down as a secondary cause of being air pollution. And so that just really demonstrates the impact that what we're doing to the planet is really just having an effect on everybody and everything. Next slide. So what is net zero? Because that's probably the biggest buzzword that you'll hear. So the definition there, target of completely negating the amount of greenhouse gases produced by human activity to be achieved by reducing emissions and implementing methods of absorbing carbon dioxide from the atmosphere. So currently it's recognised net zero is achieving a 90% negation of emissions from the atmosphere. So if you were to look at a company, if you imagine their whole footprint is 100%, they need to reduce their emissions down to only 10%. And then once reaching that 10%, they would be able to potentially offset those. And the way that you can do that is, you'll have heard of the common initiative of planting trees. So planting trees is essentially a method of sequestering carbon from the atmosphere. So we all know that plants take in carbon dioxide and goes out fresh oxygen, and that is a way of removing greenhouse gas emissions from the atmosphere. Other methods you can do it that are recently happening, especially in the Tees cluster on the coast, are things like carbon capture and storage, where they are basically directly capturing carbon from the atmosphere and storing it in big, massive pipes with rocks underneath the sea. And I think their current capacity is 20 million tonnes. But to put that into perspective, the NHS itself emits 25 million tonnes of carbon a year. So that's one organisation, our healthcare organisation, emits more carbon than what can even be captured and stored. So when you think about all the other industry, our own personal footprints, it's actually really difficult to try and reduce and get rid of those emissions from the atmosphere. Next slide, please. So how can innovation help with achieving net zero? Eleanor obviously mentioned that the net zero has a target of 2045, and that's for scope 1, 2 and 3 emissions. I haven't gone too deep down into what they are in this because they are complex to understand, and that's something that we can help to support further on. But essentially, emissions make up a person's carbon footprint, and within that, we look at the activity of a person, a business, an organisation, and we can give out their footprint amount. So we've done it as an organisation, so we know what we're emitting, and then we can also do a targeted action plan, but I'll go into what that means a little bit later on. So in terms of innovation, so obviously you'll have heard they can replace an existing product or process. It allows out of the possible thinking, which is needed when navigating new areas of focus, specifically things like net zero. As I said, it is a new term, it's a new buzzword. People don't have a lot of interaction, a lot of experience with it. So how can we begin to address problems when we don't understand the impact, what the problems are in the first place? So it does allow for that out of the possible thinking. The sky is the limit, which is what we like to use at HINENC. It can be designed with circularity in mind. So one of the key things for innovation currently going forward is thinking about the end at the point of conception. So you might have heard of circular economy in the waste hierarchy. So it's a cradle to grave theory. So when you are developing a product, you are building it thinking about how it's going to be disposed of when it's no longer needed, it's no longer functional. And the whole point of that is to try and mitigate for the potential impact it could have on the environment in that waste disposal method. People will be aware of landfill. A lot of people are trying to shift away from that now. And one way that you can do that is building in sustainability at the beginning of a product's life cycle. So thinking about the materials, thinking about the manufacturing, thinking about the structure of it. Is it a one-piece product that's injection molded? Is it modular, which means it can be taken apart? It might be able to have parts replaced, which would then prolong the life cycle of the product. And all those things can be factored in at the very beginning. Sustainability can be embedded at the earliest opportunity. So obviously, given the NHS targets, we do try and get that message across to innovators. We want people to consider it as early as possible, because it's a lot easier to do something from the beginning than it is to go back and do it retrospectively. It can address challenges. So currently, there's a lot of single-use products, particularly in the NHS, and they are 9 times out of 10 plastic. So we can potentially have a single-use product, and we can say there is a challenge that we need this to become reusable, because the impact of it being single-use on the environment in terms of disposal of the product is too great. So how can we make this reusable and sort of reduce the impact on the environment through that one particular product? And of course, just to remember, the purpose of innovation is to always increase efficiency, problem solve, and encourage growth. And it's never to make something worse than what's preceded it. We always want to improve. Next slide, please. So what can you do as an innovator? So there's different branches of sustainability. So you can think about it from the perspective of an organisation. So you can embed sustainability at an organisational level, and you can also embed sustainability at a product level. So one is the way that you are acting as a business, and one is the output of your business. So in terms of organisational level, you can do things like carbon footprinting and reduction planning. So when I said every person has a footprint, every organisation has a footprint. So every bit of activity you do is producing carbon emissions, whether it's direct or indirect. So just by, if you lease a building, you have a carbon footprint of that. If you switch the lights on in your office, that's producing a carbon footprint. And what you can do is you can gather all this data, develop your footprint, which will identify carbon hotspots, which you can then create an action plan of how you might reduce those hotspots and reduce your organisational carbon footprint through the activity that you're doing. You can also have environmental policy. So within that, you can look at things like ISO standards, which can help you with things like procurement. It can help you with social value, which I think is going to be talked about later on. It can also help you with how do you just operationalize, what do you need in terms of governance as an organisation. And there's various online organisations that can support you and signpost you in that. Be compliant with legislation. There's obviously the Environmental Act of 2008, and then there is also various legislative acts around different things to do with things like wildlife. There's ones about greenwashing, which comes on to the next one. So to educate your workforce, which would allow you to embed sustainability a lot easier and avoid that greenwashing, because it is illegal to greenwash. And what greenwashing is basically saying you're doing something that you are not doing. There has been multiple cases of this. So I think Sky did it. They said basically they were carbon neutral, I think in about 2006, but actually they weren't carbon neutral. They'd either mix their numbers up or they had done something to hide. They do have a case study online that you can go and look at. They'd done something to hide what they were doing and masked it as if they were carbon neutral, and so they got sued essentially, and they got a hefty fine under the environmental sustainability legislation, and they are now actually carbon neutral, and I think they're probably close to net zero, which their target is 2030. So although it's a new subject, there is actually infrastructure to support consequences if you aren't complying with these things. And that's really important from an organisational perspective to remember. And then thinking about it more granular at a product level. So things we can do is you can do a life cycle assessment on a product, which will give a product's individual carbon footprint. which is really helpful to us. You might have heard of cost benefit analysis or budget impact modeling, and what that allows you to do is to basically look at how, if you remove or introduce a component, what the impact would be on the overarching cost. With a life cycle assessment, we can do that with a product in terms of the carbon impact. So we can look at a pathway, we can remove an existing nodule that I would sort of expect to encompass what an innovation is replacing. We can put the innovation and we can look at the difference that that might have on that clinical pathway and the overall footprint of that pathway. Manufacturing, so looking at your manufacturing processes. Are you manufacturing in somewhere like China? Can you bring that to the UK? That would reduce footprints massively. And this is all something that you would think of at the concept of a product or an idea. Materials, I did mention before, plastic is sort of a taboo area in sustainability. It can't ever be eradicated in terms of medical products, but how can we minimize the use of it? What are the alternatives? And that can obviously be done across a range of materials, but that's just the main example. And then that cradle to grave theory that we would implement at the beginning of the concept of a product. So what is the end of this product's life cycle going to look like, and how can we try and mitigate that as much as possible at the beginning of the product life cycle? Next slide. So in terms of supplying the NHS, obviously as health innovation, our key role essentially is to help innovation in the NHS to help them achieve and meet their targets. Greener NHS and NHS England have set out a net zero supply roadmap. Coming back to that legislation, this isn't legislation, but it is a level of compliance that suppliers will have to have in order to supply the NHS moving forward. So you can see in procurement contracts, they've already written in 10% weighting to net zero and social value demonstrated by a company. So any person who completes a contract from 2022 will have had to address that. For carbon reduction planning, which comes back to the footprint, an organisation is expected to have a carbon reduction plan by 2027. This has recently been adapted to a net zero commitment if a contract is under £10,000, but anything over £10,000 requires a carbon reduction plan by 2027. At HINENC, we are trying to implement that as soon as possible, because when we think about how long it takes to develop and get an innovation into the NHS, by the time you reach that point, from now, you probably are looking at needing to be compliant with that almost straight away. So yeah, we are trying to embed that at the earliest point, and that's support we can provide through our innovation pathway. And then product level requirements, which is that life cycle assessment at a product level. So from April 2028, the NHS will require every product that they procure to have a life cycle assessment, and that's to allow them to capture scope 3 emissions as part of their supply chain, because scope 3 emissions are supply chain, manufacturing and downstream activity. They also have a sustainable supplier accelerator, which also has a toolkit made up of webinars, activities and support and resources that's been created by NHS England's Net Zero and Sustainable Procurement team. So you can have a look at that. And also the Evergreen Sustainable Supplier Assessment, which is a database to allow NHS to start benchmarking their suppliers. So you basically sign up to be on it, and then you complete the assessment, inputting all of your current carbon targets, reduction plans, action plans, things like that, and what you're aligning to in your net zero commitment. And then you can achieve either a level 1, 2, 3 or 4 criteria, and dependent on the level, the requirements of that become more excessive. So for the first level, you just really need a carbon reduction plan or a net zero commitment, all the way through to level 4, which is a fully life cycle assessed portfolio of products. You would need to have your modern slavery, you would need to have social value statement and demonstration of all that. But all of that you can find on the Greener NHS website. Next slide. So the tools you can use, as I mentioned, was a Sustainable Supplier Accelerator, and you can also find the Evergreen Sustainable Supplier Assessment. The SME Climate Hub has been a tool just indicated to us by NHS England recently as a really good support mechanism in terms of resources. And obviously as HINENC, we can support you in accessing and talking you through the steps of that. But it is one that has been recognised by them. So I think if you are looking through that and trying to meet what that's setting out, you're probably on your way with the NHS. And also they do have a carbon reduction plan check-in service on that email that's there. You do have to allow 28 days for them to get back to you, but basically you can send a carbon reduction plan and they will give you feedback on whether it's it meets requirements, if it's adequate for what they're looking for, before you look to apply to be on the Sustainable Supplier Assessment. So you can sort of improve your chances of being accepted through that. Next slide. So how we can support you. So as I've mentioned, we can do signposting to various services. So we can support you with the SME Climate Hub. We can support you with navigating all of the NHS supplier roadmap. We can support you with carbon reduction plans, introducing you to organisations that can help you to get these policies and action plans in place. We can help with funding support. There is a funding call coming up with NIHR, which is looking at the decarbonisation of the health and social care sector. It's really a one of its kind pot. It's not been done before. And we're always looking for opportunities for net zero funding and how we can support innovators to access that. Compliance, we can support you. We can do a bit of a gap analysis and let you know what you might need, what you're missing in order to be compliant, to be a supplier to the NHS, but also just so that you can be assured that as a company you're on the right track. Because while there is NHS targets, there's also national targets. There's a UK national target to achieve net zero by 2050. So this is going to be, that's government led, which means it's a national thing, whereas the NHS one is probably only more relevant to organisations and innovators. As a company as well, you also do need to incorporate the government's targets and what they set out for operating. We can support with stakeholder engagement. So whether that be sustainability managers, we can also support with net zero in local authorities. It just really depends what level you are looking to engage with and what is required in order to develop and progress your innovation. The carbon footprint and reduction planning support, and just generally understanding what is required of an innovator and a supplier to make sure that you are on the right track with your innovation or with your organisation. Next slide. Oh, sorry, I didn't realise that was my last slide. But if there's any questions, please just put them in the chat. There is probably a lot more that I could have had in them slides, but it would have been information overload, and yeah, it's not what is needed here. But I'm more than happy to speak to anybody more in depth about anything that we've covered. And yeah, I hope that was useful.
Thank you very much, Hannah. That was a really, really good overview for net zero and sustainability. So as Hannah said, she is the guru and found some knowledge for all of this. So if anybody has any questions, please put them in the chat, or you can get in touch with Hannah at a later date as well, and she'll be able to help you with those aspects of your innovation. So next on the agenda, we have a recording from Ben Porter, who's one of the programme managers at Health Innovation North East North Cumbria, and he'll just give a high-level overview of PPI.
Hello, my name's Ben Porter. I'm one of the programme managers here at Health Innovation North East North Cumbria, and thank you for allowing me to provide this presentation today on patient and public involvement. Sorry I couldn't be with you. So just a little bit about me in regards to patient and public involvement and my background. So my current role, I am one of the programme managers here at HINENC, as I mentioned, but previously I was a rare disease patient registry project manager, which involved working very closely with over 1,000 patients with rare diseases and managing 2 national patient registries and helping involve those patients and caregivers in various research projects in order to help better understand the disease progression and also how to involve them in future clinical trials with a number of pharmaceutical companies and biotech companies. And I've also worked as the PPI manager for the NIHR Newcastle Biomedical Research Centre, the Clinical Research Facility and the MedTech in Vitro Diagnostics Cooperative. So that role was working with those 3 different infrastructures to help implement those good PPI essentially within the organisation. So making sure that there's representation in governance structures and making sure that any projects that were being conducted within the university that were relevant to those NIHR infrastructures kind of was assessed and involved public contributors in dissemination plans and the design of potential studies as well. So that's just a brief background to where we're coming from here in regards to PPI today. So just very, very brief. I know I'm not there in person, but if people can have a quick think about what do you think PPI is? If I let people just think about this for, say, 10-15 seconds. Okay, so just a little bit of myth busting. So what it is, so according to the National Institute for Health and Care Research, public involvement is really defined as research that's being carried out with or by members of the public rather than to, about or for. So it's all about that active partnership and making sure that it's kind of a two-way street between patients, carers, members of the public, and how they can really shape and influence research. So a lot of it comes from their kind of experience and their expertise. So what it isn't, so when members of the public take part in research, of course, some people will be aware this is research participation. So that's kind of like asking somebody to complete a study or a survey. And then if you host an event and research is being discussed and disseminated or debated or presented, this is typically known as engagement according to the NIHR definitions. So just to clarify that, there's different meanings for what we mean by involvement, engagement and participation. So why do we do it? So really we want to address those questions of relevance to health and social care professionals and the public. We want to make sure that we're really getting those the opinions that matter. Can also, good PPI ensures that the design of research and projects actually take into account who those projects are going to be carried out to. So really thinking about the burden or the impact that the project may have on a particular patient group or a different group in society. We do patient and public involvement to really clarify the research question and identify relevant outcomes. Again, so you can be doing focus groups with members of the public or a patient group to understand what they want from, for example, a new treatment being developed for asthma. And then also it helps us develop research information that's communicated in a clear and accessible format. So a lot of people will be familiar with, research publications in certain journals. Well, this is really good PPI can help make sure that there's versions of that that's accessible and is meaningful to the actual group that you've involved in the research. So it's in a very clear language that people can understand what's taking place. So when do we do PPI? So PPI can really be considered at a number of different points in the research process. If you think about right at the start when you're really identifying the topic or the questions that you want to address, this is the point where you really want to be thinking about who is the cohort or who's the population or audience that we really want to engage with. This will really help inform the process that the process that takes place in order to answer the questions that you want to address. So if you are designing a new innovation, for example, this is the point where you start thinking about, okay, who are we designing this for? Who is the end user, and also who do we need to engage to really shape that and co-design that so that the final product is actually going to be meaningful to that population. As you can see from this this infographic, there's a number of key stages for when PPI can be considered. So I'd certainly think about looking at this and taking it in and to think about when can we really involve those relevant groups. So here are some examples of PPI. I think these examples come from an NIHR resource. So this isn't exhaustive, but it just gives you a bit of a flavour for what different PPI activities look like. So when you're applying for funding, for example, you can actually have joint grant holders or co-applicants on a research project, and sometimes this can be a public contributor or a patient representative who's very knowledgeable and could help design or run parts of the project. Another example of PPI is, identifying research priorities within a specific group. So again, this can be the public, or it could be a specific patient group or disease group. Members could form part of a project advisory or steering group. This is usually really good practice for kind of any project to ensure that you've got those governance structures in place, and so there's representation from, like I said before, potentially the end user of a new innovation that's being developed. As further examples of PPI include, being able to comment on and co-develop patient information leaflets or other research materials. So that can be things like, the study results as well. Also, PPI includes undertaking interviews with research participants, and then carrying out research as the user or care researchers as well. So that's a really hands-on role for the public contributor here. So what's the role of PPI in innovation? So we really want to ensure that the research priorities and the innovations or services that are being developed involve those meaningful collaborations with those who have the relevant lived experience. So there's no point, speaking to the public if you're developing a new service that's very specific to kind of the rheumatoid arthritis pathway. You really want to get those people with the lived experience who've gone through services, they've had good experience and bad experiences, and you really want to get them to help shape that. So yeah, it's really important to identify the right groups to involve in the work that you're doing, especially when developing innovations. So here's some funding considerations. So again, quite often PPI is thought of as a nice to have, when actually it is an integral component of developing research and developing new innovations. So if you're applying for funding applications, it's definitely worthwhile including PPI activities within that, as well as costing them appropriately. So a part of that is really making sure that you plan to remunerate those public contributors or patients within your project. So I've provided a couple of resources below, which come from the NIHR, and they've been developed over time, and they've been honed, and there's been a lot of consultation that's gone into them. And they include some guidance for both researchers and professionals, but also for members of the public as well. And within them, there'll be different kind of rates of remuneration as well for different types of activities. So it's certainly worthwhile checking those out. And then I've provided a number of resources here as well on kind of where to start. So at the top you have the UK standards for public involvement in research, along with a number of NIHR PPI resources. There's also an NHS England resource here which links to the Accelerated Access Collaborative and how they're involving patient public involvement in the early stages of identifying which new innovations are supported within that programme. Some people might also be familiar with the NIHR Applied Research Collaboration as well, here in the North East North Cumbria. So there's various public involvement resources there. And then there's 6 further resources here which should also be useful to kind of get your head around PPI and some key considerations. People might have different levels of understanding about what it is as well here, so kind of you can cherry pick from some of those resources. And then that brings me to the end. If anyone has any questions, please feel free to share these with Rusty and Chloe, and they can pass them on to me, and I'm more than happy to provide some clarification and answers to those. Here at HINENC, we have some good connections with some of the regional infrastructure, so hopefully if there's any support you need, we can help identify what that support may be, and also signpost you to the relevant organisations who can actually give some of that support as well. Thank you all for your time, and thank you for having me as well. Cheers now, bye-bye.
So that was Ben filling us in about PPI. So a really important part to all innovative projects, and something to think about from the start. So next we'll move over to Ellie, who'll give us an overview of evaluations that we do at Health Innovation. So it's over to you, Ellie.
Brill, thank you very much. I think I'm sharing my screen, is that right?
Yeah.
Has that worked?
Yeah,
that's
I
fine.
can't see anyone else.
Yeah,
Brill. Brilliant. So yeah, hi everyone, I'm Ellie. I'm the Evaluation Liaison Manager here at Health Innovation North East North Cumbria. And today I'm just going to be whizzing through kind of like the topic of evaluation. Is that moving? Sorry. It's not moving. No, sorry. Yeah, so what I'm going to go through today is kind of where evaluation sits on the innovation pathway, and then kind of touch on the evaluation support offer that we provide at HINENC, and then also just touch on some of the key considerations that you might think about when thinking about evaluations. To start off with, whereabouts evaluation sits on the innovation pathway. So it sits under Gateway 3, so right in the middle here, and it's made up of these 4 key aspects. So if we just go through some of them, so clinical trials and evidence generation. So the clinical trials aspect is very much around testing of new treatments, new products in very controlled environments. And the evaluation is very much around looking at the safety and efficacy of that. And it's really the gold standard of evidence generation. And I'll touch on clinical trials a little bit more in the later slides. Regulatory approval also sits under the evaluation gateway within the innovation pathway. And this is very much around focusing of ensuring that a device or a software is safe for patients to use. And gaining that regulatory approval really helps gain the trust of clinicians and clinical teams that are using the device or the technology as part of their clinical decision making. And not every technology or innovation may need like as robust regulatory approval, but it's something definitely to consider when going through the innovation pathway and the evaluation stages. The real world validation is very much around the process of gathering evidence to demonstrate the value of a new product within real world settings. And then your health economics is very much around based on the development of generating evidence to support a business case. And it's there to present things such as the cost effectiveness, the value for money, and how that impacts on the health and care and the technologies around that. So you can see that each subtype of evaluation is very different, and therefore the focus and the focus of evaluation will change depending on the type of evaluation that you're looking at, and then obviously the stage of the innovation pathway. There's also something to consider is that different aspects of evaluation can also appear across different stages of the innovation pathway and earlier on. And also again, that because of this, the focus of potential thoughts and evaluations will change depending on where you are in that innovation pathway. So kind of looking at some types of evaluation questions and what the main focus of evaluations would look like, and then linking them to the stage of the innovation pathway. So those really early, so like that basic research, you're wanting to look, well, in theory, would my innovation work? So you're looking at that kind of basic research. Also kind of looking at whether, you've developed a product and, well, is it acceptable to patients and staff? Then looking at collating that expert feedback and getting that public and patient involvement within that process. And also that evaluation of a prototype as well. So it's slightly earlier in the innovation pathway. Then kind of looking at some of the evaluation examples in Gateway 3. So in your clinical trials or your pilot circumstances, you'd be wanting to understand, well, does my innovation work in an ideal circumstance, so your clinical trial setting, or in a pilot circumstance. And then moving on to that questions of real world validation. Well, does my innovation work in a real world setting? Does it work across multiple sites? And how is it implemented? So hopefully that gives an idea and a flavour of the types of evaluations and the questions and the focuses that might be relevant depending on where you're at in the development of your innovation. And then this table here just highlights again some of those types of evaluation questions and the evaluation types that you as an innovator might be required to explore, depending on, again, the purpose and the stage of the evaluation. And it's generally, although not every innovation will need to go through every single step of an evaluation, it's generally thought that they'll need to go through several iterations of evaluation stages before kind of progressing to that gateway for wider adoption and spread. And then really each evaluation iteration is there to help generate evidence to progress to that next stage in the innovation pathway, whether that be to the next stage of evaluation or the next stage of the innovation pathway going on to Gateway 4. So just a few examples. So as I said just previously, that Gateway 1, Gateway 2, you're wanting to understand whether your innovation is acceptable to patients and staff. And the evidence you'll be collecting will be there to really develop your product further. And a really good way to do this is through conducting those focus groups and that type of evaluation. Moving on to kind of Gateway 2, Gateway 3 is conducting potential pilot of your innovation. So you're really wanting to understand, well, does my innovation work in a pilot circumstance? And you'll be generating evidence to potentially secure more funding for wider adoption or a wider evaluation. And a really good way of doing this is a controlled before and after type of evaluation. So looking what the evidence is showing and what are the outcomes before you implement your intervention, and then following and evaluating that post implementation. And then further down the innovation pathway, so into looking at more of like your real world types of evaluation, you're really wanting to understand, well, does my innovation work in real world settings? What are the lessons learned? What are the barriers or facilitators to adoption? And you might be wanting to undertake this type of evaluation to really provide that evidence to convince other regions to adopt your innovation. And a way to do this is through something called a process evaluation. So I hope, again, that gives an outlay of kind of the things to consider and the different options of an evaluation, depending on the stage you're at. So moving on to look at the support offer that we provide at HINENC for innovators. So this is a flowchart here kind of presenting the overview of the support that we provide, and it's very much based around a tailored support offer through understanding what each innovator needs to progress to that next stage, as I've mentioned. And just to say that our evaluation team don't carry out the evaluations ourselves. Our support model is very much based around utilising the expert knowledge that we've got across the region from academic or industry evaluation partners. So if we just start from the left-hand side, generally innovators are supported through previous gateways by other HINENC colleagues and are directed to us, the evaluation team, as and when needed. And to make sure that the evaluation support that we provide is appropriate, we generally ask for some prerequisites to at least be considered before that proper engagement. So we consider potentially, is there a value proposition being completed? Have you identified or secured funding, or are in the conversation of around applying for grant applications? Something to consider is, have you identified adopting sites that are willing to be part of the evaluation? And also to provide us with any previous evaluations that have been completed to help us understand what evidence has already been collected. So kind of once we've got that and wanting to that initial engagement, it's very much focused around this middle one, around having that discussion with the innovators around what is needed, what do you need out of an evaluation to progress to the next step. And then to support with this, we ask innovators to complete this initial evaluation scoping form, and it's there to help us understand what you need and to really help facilitate that initial discussion. So we ask for a little bit of background around the innovation. What is it? Have you conducted any evidence generation previously? And then there's a section around, well, what do you want to achieve? So really thinking about what would you like the evaluation to answer, and what are your main evaluation questions? What are your key aims and objectives? And then to start having to think about, well, how might you want to achieve it? You know, what are you wanting to undertake? Interviews, focus groups, what type of data you might be wanting to collect. Now, it's by no means we expect like a finished product. It's there just to help facilitate that initial discussion. It can be amended, it can be adapted, but it's there to help that engagement in the first instance. And then once we've had that initial discussion, as I said, to really help understand what you need as part of an evaluation, what an evaluation might look like, we then bring in the expertise that we've got across the region. And there's two main ways we either do that. One of the ways is we act as that almost like a matchmaking between yourselves as an innovator and the relevant evaluation partners. And as I've said, that might be academic or industry partners. And we use the scoping form that you've created to initiate those conversations, to establish whether there's interest and kind of get their ideas, initial ideas of wanting to support with the evaluation. And this will help then set up conversations between the innovators and the evaluation partners, which we very much help facilitate. The other way we can do it is through the direct commissioning from HINENC to the evaluation partners through our DPS system, and that's essentially if HINENC hold the costings and the budget for the evaluation. But there's different ways and there's different nuances to it. But in both circumstances, it's very much around, we're there to continue to support the innovator through that whole evaluation journey, from those initial discussions right to the end, and then ensuring that, you know, post-evaluation, the support continues from either ourselves or other HINENC colleagues. So hopefully that gives an idea of it's not by any means a one-size-fits-all approach. It's very much around how we can provide that tailored support to an innovator at the specific time that they need it. So I've just popped on here just a kind of overview of the different types of system partners that we've got across the region and beyond that will support with evaluating and providing evidence generation, you know, right from that basic research to clinical trials and right up to the real world evaluation. And these are all the ones that, you know, we can lean upon and we can draw upon their expertise to help support with the evaluations. I also just wanted to now touch on some of the key aspects and key considerations for evaluations and real world evaluations that you might want to think about kind of when engaging with us, when completing the scoping form, when engaging with the evaluation partners. And these are all kind of things that we think about to support you. And it's also kind of like it would be good for you to think about as well to help support those conversations. So in the real broadest terms, evaluations are really there to help you consider what works, what doesn't work, and how things can be improved. And when we talk about evaluations, as I've said, there's a range of different types, and they can span from, you know, really simple service types of evaluations right up to really complex research projects. And each evaluation needs a different approach depending on the purpose of the evaluation, the current evidence base that's been generated, the stage of development of the innovation, the context, the resources, the timescales, and all of these things impact on kind of what you're trying to achieve and how you want to do it. So I've highlighted here some really high-level broad categories of types of evaluations that could be considered. So for example, if you're requiring more definitive answers of, you know, does my innovation work? And kind of focusing on more of those outcomes types of evidence, then summative evaluations could be the most appropriate. And these are generally seen earlier on in the innovation pathway and can be seen in those clinical trials. But if you're wanting to understand and learn from the understanding of issues and ways to fix them along that evaluation process, then formative evaluations might be the most appropriate. And then if you're wanting to look at understanding the process involved with the intervention and the interacting components for the implementation of it, then those process evaluations would be most appropriate. And real world evaluations very much focus more on this process evaluation type of approach. And then just to touch on the different types of evaluation methodologies. Again, as I've said, there's a really broad different types of evaluations, and obviously with that comes a whole range of different types of study design. And these are some of the things that not only we think about, but also this is what we'd be drawing upon the experts from the evaluation partners across the region that we've got. You know, they'll be able to advise on the best and most appropriate study design to really get the most out of your evaluation. So just to pick out a few, kind of, as I've mentioned before, those randomized controlled trials, the gold standard of evaluation, they might be most useful for those early evaluations in controlled environments, and they may be required for regulatory approval. They've got really rigorous designs with randomized control groups, but potentially not always feasible to undertake for complex innovation, sorry. You've also got kind of like staff and user feedback, and this is kind of like the qualitative aspect of study design, and it's a really effective way of generating that feedback and obtaining kind of those experiences to help develop the product and help develop implementation as well. Then obviously the economic evaluations, as I've mentioned, kind of looking at the cost effectiveness of the innovation. So it's just kind of an example of the different types of study design to think about, not necessarily have that knowledge around the details of them, but it's what the evaluation partners would be very much taking you along the journey of. And then alongside that is to kind of think about the different types of data to consider. Again, when you're thinking about an evaluation, when you're thinking about completing the scoping form, and when you're having those conversations with the evaluation partners, thinking about what data is available. You know, whether is it patient-generated health data through wearable technology, through apps, things like that. Whether it's health surveys, interviews, focus groups, as I've mentioned, that's a really valuable way to get that feedback. Understanding whether there's routine data that can be collected from things like chart reviews, or if there's patient registries, or if there's not of that available, would an evaluation require some primary data collection? And if so, what would that be? Is that feasible to collect, and things like that? So again, all these things to consider when thinking about an evaluation. And then I've just noted down here, you know, as I've said, things to consider for an evaluation. So what is that? Is the data routinely available? Can it be collected? In what format? And if not, is there a bespoke data collection that needs to be established, and kind of work with the evaluation partners and work with the evaluation sites to develop that as well. Also, some things to consider is, you know, what's the intended impact of the intervention and the innovation? You know, have that thinking of, because of my innovation and because I've implemented it, what has happened, and can we put some causal impact to that? And thinking about this really helps identify the right method to help answer that question. And also something to consider, not to put a dampener on things, but also, you know, what are the realistic outcomes? And it just helps manage that expectation from both the innovator side, but also kind of the evaluation partner sides as well, and the adopting sites. And then just finally, just to touch on real world evaluations. So there's quite a few definitions, and I've put some links in at the end to real world evaluations, but the overall most common aim of a real world evaluation is to generate sufficient evidence and a meaningful economic argument to support a business case to persuade the NHS to alter their clinical practice and their care pathway to accommodate the proposed innovation. And some of the benefits of doing a real world evaluation, it can really help with that adoption and spread of the innovation, as they can provide potential adopting organisations with the understanding of the implementation pathway and the assurance that there's actual benefit to the product. And it helps increase that buyer confidence that the product does what it says, and it provides those benefits to the system. And real world evaluations may actually be more appropriate than randomized control trials in certain circumstances, unless it's a case potentially for digital technologies. And I'll just run through kind of some of the variations between them. So real world evaluations compared to clinical trials are often a lot more pragmatic compared to those clinical trials, which, as I said, are at that gold standard and academically robust. But you can have those pragmatic real world evaluations. Generally, real world evaluations are less expensive than those clinical trials, but do come with a cost, but are generally less expensive. Because of not being able to introduce a randomization and the blinding that you can see that's is the case in clinical trials, there is a risk of bias in those real world evaluations that need to be identified and potentially accounted for. In regards to ethics, for real world evaluations, ethics may not be required, but it's kind of like a dependent on the type of evaluation, but patient consent may still be required. Whereas with the clinical trials, the ethics approvals will be required. And then in terms of kind of providing that evidence generation for implementation, this is where real world evaluations are really useful for implementation planning. You know, what are the facilitators and what are the barriers to implementing the innovation? Whereas those clinical trials are often more around the safety and the efficacy of the innovation. And this is just to touch on where real world evaluations sit in terms of that evaluation gateway. And they're very much at the latter end of evaluation. So they're taking place following on from, you know, you've done the basic research, you've potentially got your regulatory approval obtained, undertaken pilot evaluations and things like that. And then you're getting to that real world evaluation, so the later stages of convincing a wider audience. And then just to bring it back round to this slide, it's just to kind of really emphasize that the support offer that we provide and in general evaluation is very much not a one size fits all. And so it's really key to have that in-depth conversation with innovators and ourselves and bringing in the expertise from across the region to really emphasize and understand what is needed to progress with the evaluation and to progress with the next stage. And as I mentioned, kind of bringing it all back round is kind of where it all sits and then moving on to the next phase of the innovation pathway. So I've just popped in some definitions and some guidance links as well, if that's of help. And thank you very much for your time and happy to answer any questions.
Excellent. Thank you so much, Ellie. That was really, really interesting. If anybody has any questions, please pop them in the chat or feel free to unmute and ask Ellie a question. Or if anyone thinks of anything, please just, again, like the other presentations, just let us know, or contact Ellie on her email address below. And yes, we will be sharing slides after the webinar's ended as well. Thank you very much, Ellie. So next we are going to go on to the final presentation. So this is a pre-record by Anna Bassett, who's a project manager at Health Innovation. And she's going to bring it all together and talk about sort of the innovator engagement process and sort of next steps. If you want to work with Health Innovation North East North Cumbria, if you've got any queries, how to go about it. So we'll hand over to Anna's presentation.
Hello everyone, thanks for joining us today. I'm Anna Bassett, Project Manager for the Innovation Pathway at Health Innovation North East North Cumbria. I'll be discussing the Innovator Engagement Form and the overall process involved in engaging with our Health Innovation Network. This form serves as a critical tool to capture essential information about innovators seeking support. We aim to ensure clarity and efficiency in the process, making it accessible for innovators to articulate their ideas and needs. Today, we'll delve into each section of the form, discuss best practices for completion, and outline how this information guides our support and decision making. So let's get started. When an innovator reaches out for support to advance their innovation through the innovation pathway towards NHS adoption, our first step is to send them the Innovator Engagement Form. This online tool is utilised across the whole Health Innovation Network. It gathers information about the innovation, progress made so far, and any other relevant details that may be needed. When completing the form, it's important to keep a few disclaimers in mind. First, please refrain from disclosing any unprotected intellectual property. If necessary, we can arrange a non-disclosure agreement to protect your information. We encourage you to provide as much detail as possible, as this will help us better understand your innovation. By submitting the form, you consent your information being shared with the Health Innovation Network, although we will not disclose your information to other innovators or companies. Completion of this form indicates your agreement to participate in the Network Economic Growth Annual Survey. And finally, you will only need to complete the form once, unless you're submitting it for multiple different innovations. The first page of the form inquires about the innovator's relationship with sanctioned states. This is necessary because health innovation networks are publicly funded NHS organisations and they must comply with national policies regarding sanctioned states. On page 2, we require organisational and contact information for the innovator, including the company registration number, address, and the name and email of a point of contact. Page 3 asks for a summary of the proposed innovation. It is important to note, however, that only one innovation can be logged per form. We request the name of the innovation and whether it's a product, a service, or a combination of both. And additionally, we ask for categorisation details such as the innovation type, intended care settings such as community, hospital inpatients or hospital outpatients, clinical areas like ageing and cancer, and relevant themes like prevention or diagnostics. The innovator should provide a brief description of the innovation, detailing its purpose, functionality, clinical context, target patient group size, and the problem it addresses. This section should clearly articulate the unique selling point that distinguishes it from existing solutions. And the final questions in this section focus on engagement with customers and stakeholders to demonstrate how the innovation aligns with NHS priorities. We also want to know about any market research that's been conducted on competitors and how the innovation differs from existing technologies, products or services. We ask about patient and public involvement in the innovation's discovery and development, and lastly, its potential to address health inequalities. We aim to support innovations that are accessible to a broad audience, particularly those facing significant health challenges such as diabetes, mental health issues or cancer. Factors such as location, economic status, age, ethnicity, literacy levels and access to technology can all impact how individuals engage with your innovation. Thus, we seek your information on whether your innovation addresses issues like digital access, data poverty, barriers for people with disabilities, and the needs of diverse ethnic communities. Some innovators may be tempted to provide extensive responses in this section, but we encourage a focus on quality over quantity. It's essential to convey your ideas in a manner that is clear and understandable to those who may not be experts in your field. Page 4 asks the innovator to briefly explain how their innovation currently or plans to have an impact on NHS net zero and/or environmental sustainability, whether this is direct or indirect, and also if the innovation contributes to other environmental benefits, for example, air or water quality, or better use of natural resources. In line with future requirements, we ask if the innovator has obtained a carbon reduction plan or net zero commitment and whether it is being quantified. It is okay if the innovator is not at this stage yet, as long as this is something which has been thought about. Pages 5 and 6 outline the current progress, including any external funding secured for the development of the innovation, as well as its current maturity as displayed on screen. With an initial idea, we want the innovator to outline the foundational work behind the idea. This helps us understand its origins, especially if this hasn't been previously mentioned in the form. The intellectual property field allows the innovator to explain what existing IP they hold, such as patent numbers. If IP hasn't been secured yet, this can be noted as well. It is also important to mention if the IP is jointly owned or if it belongs to another company or organisation. When addressing user testing, we want to see that the innovator is focused on the needs of those who will benefit from the service or product. It's important that the innovation is both practical and user-friendly. This goes beyond professional users to include everyone who interacts with the product, including patients and the public, otherwise known as patient and public involvement. PPI is crucial in shaping the design and improving the innovation or service. Proof of concept is for the innovator to explain what they have done to date to demonstrate the effectiveness of their innovation. And the prototype field is also useful to understand if the innovation is at initial or final prototype stage. This could be a physical device or tool, or it could be a software. Responses to clinical evidence allows the innovator to share details about any clinical trials or studies that have been conducted to demonstrate the effectiveness of the innovation. High quality evidence is essential, not only for regulatory approval, but also for building a strong value proposition. If any pilots or real-world evidence studies have been conducted, high-level details should be included within this field. This could involve information about study locations, sample sizes, and any other relevant data. For regulatory status, regulatory requirements are critical for healthcare innovations. Before an innovation can be introduced into the UK market, it must meet specific criteria based on its type. So for medical devices, this might include UKCA or CE marking, while digital innovations may also require DTAC approval. The ultimate goal for any innovation is to be adopted widely. So within the adoption and spread field, the innovator can outline if they have prepared a business case and if their innovation has already been adopted in any locations within the UK or beyond. Finally, the other section can be used to provide any additional information that may help in assessing the innovation. This might include links to supporting case studies or further resources. All of this information helps us assess the innovation's position on the innovation pathway and identify the initial and future support needed. Providing as much detail as possible here is very beneficial, and we also recommend including links to additional resources. Page 7 of the engagement form inquires about any prior engagement with other health innovation networks. So if applicable, please provide details about the support received and any relevant contact information for individuals they've previously interacted with. Additionally, we ask if the innovator is engaged in advanced discussions with any NHS organisations in England, such as Integrated Care Boards of Systems, NHS Supply Chain, or NHS England Specialised Commissioning. Lastly, page 8 focuses on future plans. We encourage the innovator to consider their long-term vision and what they aim to achieve both in the near term and beyond. Additionally, we seek to understand their specific support requests from the Health Innovation Network. Once we receive confirmation that the engagement form has been completed, we will arrange an introductory call with a member of our team. The purpose of this call is to gather additional details beyond the form, rather than to provide support, so it's not essential for that team member to have a specific expertise in your innovation. The dedicated HINENC team member will then present the information from both the form and the call at our weekly meeting. This discussion will help us determine whether HINENC can support and advance the innovation, as well as identify the next steps and the team member best suited to provide assistance. If HINENC cannot support the innovation, the information will be collected and will help us explore potential referrals and next steps. I'd like to thank you all for your time and attention today, but if you would like to find out more about how HINENC can support your business and to find out more about the support available via the Innovation Pathway, please do email our Pathway Navigators at the email on screen now.
So that was an overview of how you can get in touch with us. So if you email the navigators or get in touch with us via our website, you'll be able to complete those engagement forms, and then we'll be able to start the process of seeing how Health Innovation can help you. So that's all our presentations for today. So just to wrap up, so the main reason we're putting on these webinars is part of the Tees Valley Innovation Challenge programme, which is run by Edge. So this is a programme for SMEs and businesses in the Tees Valley, where we are supporting innovation with 4 key activities. So we're putting out innovation challenges, we're offering one-to-one support, some innovation training, and then an innovation showcase, which will be held in March next year. Next slide, please. So this is an overview of the challenges in the process. So the innovation challenges, there's 7 different themes. So Health Innovation North East North Cumbria looks after the healthcare theme, but there are different themes which are involved in this programme in particular. And then we'll be putting out 10 challenges. So for each of those challenges, 3 SMEs will be awarded £1,000 each to sort of scope out an idea to the challenge. And then from those, there'll be one shortlist, and that person will be awarded £10,000 to then fully develop a solution. So the next slide will show some of the challenges that we've put out. Next slide, Hannah. So these are the 6 challenges which are available. They've all closed for submission. However, we are open to sort of engaging with individuals if they are interested in any of these challenges. So if you go to the Tees Valley Innovation Challenge link below on the Edge website, they'll provide more information about each of these challenges and how to get in touch if you are interested. We will be putting out a couple more challenges over the next few weeks as well, so do keep an eye out on social media and your emails for more challenges which will be coming up that you might be interested in engaging with as well. And then think that's everything for now. So thank you very much for your attendance today. I hope it's been useful. I hope the 2 sessions have been useful for you. We'd like to extend the thanks to Edge for enabling us to put on these sessions. And if anybody has any questions sort of about the Tees Valley Innovation Challenge or about Health Innovation North East North Cumbria, please have a look at our website or get in touch with myself or Chloe, and we'll be able to answer any questions. So we'll give you 9 minutes back for your morning. So thank you very much for attending and have a good day.
Thank you.